You've been listening to the Health Broadcasting Service Radio, your radio of excellence and distinction on everything health. Coming up next is HBS Health News in Review. Stay tuned.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.
Weekly Health News in Review coming to you from the Health Broadcasting Service, HBS Radio Live channel. According to reports from Reuters, nearly 30 generic drug makers in Asia, Africa, and the Middle East will make cheap versions of Merck's COVID-19 pill under a landmark United Nations-backed deal to give poorer nations wider access to a drug seen as a weapon in fighting the pandemic. Let's look at the deaths and infections rates. The total infections and deaths for each country include both confirmed and probable infections and deaths where that data is available. If probable infections and deaths are not reported by a country, we only use confirmed infections and deaths. The data are no complete count of every COVID-19 infection and death in all countries, as the counts are based on the best available information accessible to Reuters at any given time. Countries may miss infections and deaths for any number of reasons, such as delays in processing testing data, lag in reporting, lack of testing, and so on. Some countries may exclude certain categories of infections and deaths that others include, for example, probable infections, or have different criteria as what may be counted as a COVID-19 infection or death. Some countries change the way they are reporting to include or exclude a certain category of infections or deaths, which can lead to a significant increase or decrease in their total and what they reported previously. Against this background information, let's look at the data of some randomly selected countries. Let's start with Ukraine. The average number of new infections reported in the Ukraine has been increasing for 12 days straight. Ukraine is at peak, 46% of peak, and rising. 163 infections per 100,000 people were reported in the last 7 days, as at the time of this report. The average number of new infections reported in the Ukraine has been consistently increasing for 12 days. COVID-19 infections are certainly increasing in Ukraine, with 10,335 new infections reported on average daily. That is 46% of the peak, the highest daily average reported on October 30. There have been 3,799,382 infections and 98,843 coronavirus-related deaths reported in the Ukraine since the pandemic began. Vaccination history. Ukraine has administered at least 29,517,175 doses of COVID vaccine so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 33.3% of the country's population. Now, let's take a look at the Netherlands. The average number of new infections reported in the Netherlands each day reaches new high, now reporting more than 36,400 daily. Netherlands is at peak and rising with 1,473 infections per 100,000 people reported in the last 7 days as at the time of this report. The average number of new infections reported in the Netherlands each day reaches new high, now reporting more than 36,400 daily. COVID-19 infections in the Netherlands are certainly at their peak. The highest daily average reported now, at the time of this report, standing at 36,479 new infections reported each day. There have been 3,720,816 infections and 21,188 coronavirus-related deaths reported in the country since the pandemic began. Vaccination history. The Netherlands has administered at least 32,528,802 doses of COVID vaccine so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 93.8% of the country's population. And a look at Japan passes 2 million reported COVID-19 infections. Japan is at peak and rising with 169 infections per 100,000 people reported last 7 days as at the time of this report. Japan crosses 2 million reported COVID-19 infections. They are at their peak, the highest daily average reported now standing at 30,606 new infections daily report. There have been 2,026,560 infections and 18,483 coronavirus-related deaths reported in the country since the pandemic began. Vaccination history. Japan has administered at least 202,865,566 doses of COVID vaccine so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 80.3% of the country's population. And we shall now take a look at the continents. We will start with Europe. France will ease work from home rules from early February and allow nightclubs to reopen 2 weeks later as the general COVID-19 situation in the country is starting to improve, Prime Minister Jean Castex said. Meanwhile, Austria's lower house of parliament passed a bill making COVID-19 vaccinations compulsory for adults as of February 1, bringing the country closer to introducing the first such sweeping vaccine mandate in the European Union. Next, we will take a look at Asia Pacific. India's wealthiest state, Maharashtra, will reopen schools next week, its education minister said, as new cases of the Omicron variant fell sharply. Japan's prefecture of Osaka and 2 neighboring regions are expected to join in a widening declaration of COVID-19 prevention measures, Osaka's governor said. We will now shift our focus on the Americas, starting with the U.S. The Biden administration is giving U.S. colleges and universities another $198 million to help them curb COVID-19 and address student needs such as housing and food amid the ongoing pandemic, the U.S. Department of Education has said. Canada's most populous province of Ontario has blunted transmission of the Omicron coronavirus variant and will gradually ease restrictions on businesses from end January, Premier Doug Ford has said. Now we will look at Africa and the Middle East. Israel will ditch mandatory quarantine for children exposed to COVID-19 carriers, the government said, citing a need to relieve parents and schools as case numbers spiral due to the fast-spreading but low morbidity Omicron variant. And with a look at the medical developments, the Omicron variant is not likely to help countries achieve so-called herd immunity against COVID-19, in which enough people become immune to the virus that it can no longer spread, leading disease experts have said. Brazilian health regulator Anvisa has approved the emergency use of Sinovac Biotech's COVID-19 vaccine CoronaVac on those without underlying health risks aged 6 to 17. Meanwhile, a small preliminary laboratory study has shown that levels of Omicron neutralizing antibodies of people vaccinated with Russia's Sputnik V vaccine did not decline as much as those who had Pfizer shots. We will now take a quick look at the economic impact. Bond yields backed off their rapid rise this week, and Wall Street rebounded on Thursday as investors in big tech licked their wounds after Nasdaq slid into correction territory. The U.S. Federal Reserve officials have plotted what seemed a clear battle plan against high inflation, must now contend with fresh signs the coronavirus is again slowing the economy, as well as markets conspiring to tighten financial conditions faster than Fed policymakers may have hoped. Union Pacific Corporation said COVID-19 cases among its staff and paid time off for people getting inoculated may hurt its ability to move freight in the current quarter. Meanwhile, the number of Americans filing new claims for unemployment benefits jumped to a 3-month high last week, likely as a winter wave of COVID-19 infections disrupted business activity, which could weigh on job growth in January. And on that note, we will round up on this week's episode of our weekly review. We will be back with more next week. Please remember to press the subscribe button below to stay abreast of vital and authentic global health developments from the Health Broadcasting Service. Please stay safe and remain healthy.
Health Broadcasting Service, HBS